Well, a new survey showing deep discouragement in the medical field in the wake of the president's new health care law, which will be front and center tonight. According to a new survey by the Physicians Foundation 2 years ago, more than 66% of doctors were somewhat positive about the medical practice, while 33% held a negative view. But ask the same doctors how they feel today, and nearly 80% say they hold a negative view about the future of health care, while just 23% are optimistic. The survey lends new credibility to Illinois State Senate candidate Dr. Barbara Beller's speech that got some attention back in August. It has since gone viral.
Sentence. We're going to be gifted with a health care plan we are forced to purchase and fined if we don't, which purportedly covers at least 10 million more people without adding a single new doctor, but provides for 16,000 new IRS agents, written by a committee whose chairman says he doesn't understand it, passed by a Congress that didn't read it but exempted themselves from it, and signed by a president who smokes, with funding administered by a Treasury chief who didn't pay his taxes, for which we will be taxed for 4 years before any benefits take effect, by a government which has already bankrupted Social Security and Medicare, all to be overseen by a Surgeon General who is obese and financed by a country that's broke.
Well, there you have it. Or do you? Joining me now for a fair and balanced debate, Dr. Mark Siegel, a member of our Fox News Medical A-Team, and Stanley Hupfeld, who's a former healthcare executive and hospital CEO, also the author of Political Malpractice, How Politicians Made a Mess of Health Reform. Gentlemen, thank you both so much for being here. So, you know, they say, the people who don't like Obamacare say that that doctor and politicians summed up the problems with Obamacare brilliantly in one sentence. I assume you agree, Dr. Siegel, but the question is whether there's anything that could happen tonight that would be a game changer on an issue you find very problematic. I mean, healthcare has sort of been forgotten about since the Supreme Court upheld the law.
Well, Megan, I'll add one game changer here. You know what? You might say that doctors are a special interest group, except that they're tied to a much bigger special interest group, and that's patients. And if patients get the idea out there tonight, Americans, that, you know, maybe if your doctor's unhappy, that you might not be getting the care that you need. And also, I expect President Obama to point out that the health care law is his signature legislation for a year and a half. He can't run away from it. He's probably hoping it's becoming more popular. But it's not about doctors being greedy. It's about them being overworked. It's about how we can't do the services that we want to do, about how technology is in jeopardy, about how patients aren't going to get the health care they want and that they deserve. That's the issue. And I expect Governor Romney to bring that up. And I do think that the president is vulnerable on this.
Stan, one of the issues you heard that doctor talk about in that soundbite was we have a law that's added 10 million people to the insurance rolls and not a single doctor. And this is something that Dr. Siegel and other doctors have been saying for a while now, saying, where are all the doctors going to come from to service all these new patients? Because the ones who are already in the system are already overworked.
Oh, that's very correct, and that's a real-world problem. And of course, the physician shortage is exacerbated in the primary care specialties. And so, you know, I've recommended that we rethink how we educate physicians and how we incentivize our young doctors to go into primary care medicine. We've got to fix the problem of the number of primary care doctors. There's no question.
But Stan,
but we haven't done it. We haven't done it with Obamacare. Go ahead, Dr. Siegel.
But that's the whole point.
You're absolutely correct. The law does not address that problem.
Well, not only that,
and it will exacerbate the problem because it will add lots more people seeking care now with technically an ability to pay for care. So we do have to rethink our physician specialties. And I believe the medical profession's got to rethink how it delivers care in terms of using alternative providers.
I want to make a point on that. I like to say there's two doctor shortages, Stan. There's the one you're talking about, 160,000 doctors short by 2025, according to the Association of American Medical Colleges, with Obamacare. But then there's a second doctor shortage, those of us who are dropping out of insurance because we can't handle all the paperwork, all the restrictions, all the regulations under Obamacare. The AMA, who actually backed the law, says the 17% of physicians can't work with Medicare the way they used to. That's a second doctor shortage we're facing with because of, after all, the health reform law is about expanding insurance. If you don't have the doctors that take insurance, you have a second shortage.
Go ahead, Sam.
The problem that I have with Dr. Siegel's comments is that it treats the medical profession as a monolith. And I don't believe that's true. Certainly the results of the survey, which is a very small reflection of the total physician groups. You know, I have more confidence in the medical profession. I think they're amazingly adaptable. If we listen in 1965, when I started in healthcare, we would hear some of the same concerns from some of the same kinds of physicians about the coming of Medicare. And the truth is that if we trace physician incomes, you can really see how they've increased with the coming of Medicare. So I just have more confidence that physicians can make this adjustment. We do, though, have to produce more primary care doctors.
I don't think.
What do you make of it, Dr. Siegel, that physicians are going to learn to love Obamacare? And I know you've been saying for a while and said to the producers before the show the example of the cardiologist who you do not believe will learn to love.
Well, look, Megan, I actually agree with Stan about one thing. We like to love what we do, but this is not 1965 because what's happening is it gets harder and harder to apply the high-tech solutions we have these days.
Well, give us the example of the cardiologist, because I thought that was easy to understand.
Very easy. I had dinner with one of my best friends, a cardiologist, last week, who said to me, you know what? 2 years ago, I got $550 for doing a cardiac echo. Now I'm getting $280 for doing the same test. And I was thinking, I know him well. He's not cutting down on the test he does. But everyone out there understands if you're getting paid half of what you used to, when are you going to say I can't do the same job for that kind of money?
But the problem with that analogy and that story, which is absolutely correct, is that that's been going on way before the Affordable Care Act was passed. We've had at least 10 years of efforts by both insurers and government programs to cut physician incomes. You know, I believe we do have to do everything to keep physician incomes.
But now there's a question about whether that same cardiologist is going to get overworked even more because of the new people coming to see him under an already difficult situation. Got to run, guys. I know you two will be watching tonight as they get to an important issue in this, the first presidential debate. All the best.
Thanks a lot, Megan.
Thank you.
Well, we've also got an eye-opening report ahead of tonight's debate. And